expecting that there would be a surge in cases. So this second wave has been continuing, and the step up in the cases has been noticed. This might go up to say the level of 40,000, 45,000 in that range somewhere.
राज्य सरकार को अपने वैक्सीनेशन की दर और वैक्सीनेशन के कवरेज को बढ़ाने की आवश्यकता है।
This is a very serious matter. 31,000 out of a total nationwide figure of just over 50,000 shows that we are no longer just the majority but the overwhelming majority.
The kind of cases that are coming from Kerala point out to the overall mismanagement, skewed priorities, not enforcing the protocols adequately.
Hello everyone, you're watching News Epicenter with me, Marya, Shakil. Kerala continues to be the COVID epicenter with a massive spike in cases after Onam celebrations where COVID regulations were relaxed. But the last 24 hours has seen a major spike of over 30,000 cases, a 3-month high in the daily caseload. A state which accounts for less than 3% of India's population is now reporting 65% of India's new cases and more than 50% of nation's active caseload. Kerala has one of the best healthcare systems in the country. There is easy access to medical facilities, namely in the rural parts of the state. The vaccination drive is also among the best in the country, with 75% of the adult population inoculated with at least one jab. Even though the health infrastructure in the state is not under stress yet, we are seeing the spike due to multiple factors, including the relaxation of COVID protocols due to the festive season, rise in public mobility, namely the floating population to and from the Gulf, the reopening of tourist spots, and a major section of the population with no antibodies. That's what the latest Sero survey is saying. Moreover, as per the central team which was dispatched to Kerala, there are glaring loopholes in contact tracing and containment protocols. The state government's retort is that the high number of cases are not a cause for alarm due to the treatment protocols in place, adding that the indication of a surge only comes due to the high rate and coverage of testing. But while the test and treatment measures may be robust, is the Kerala government failing to contain the spread, particularly in states where the health infrastructure is not up to the mark and is still recovering from the second wave? Could Kerala then trigger the third wave? Joining me first on the show is the state's Health Minister, Veena George. Ms. George, appreciate your time. Kerala is recording sharp rise in numbers and accounting for 60%, in fact over 60% of total caseload in India. Is this not alarming?
The second wave started in Kerala by the middle of April, almost after 1 month after this wave has started in the other parts of the country. So the strategy we followed in Kerala during the first and second wave was always to drag the wave or to delay the peak. So we have always tried to keep the number of cases below the medical capacity threshold. In Kerala, there was never a case where the patient died without getting oxygen or without getting a hospital facility or without getting an ICU facility or ventilator. So our system has proved, our method has proved successful because we could manage the number of cases with the medical capacity we have. We have always tried to, or we were keeping we were trying to improve the medical capacity by increasing the number of oxygen beds, by increasing the number of ICU beds, ventilators, etc. Also, since our strategy was always to delay the peak and drag the wave, we were slow in our progression of the wave was really slow. And this is expected at this phase because ICMR seroprevalence study shows that we have the maximum number of susceptible persons. Also, the density of population in Kerala is twice that of the national average because here we don't have any difference like a village or a town. Almost all the places are almost like the same. There is no clear difference between a city and a village, or it's almost the same. So, and also the density of population everywhere is almost the same. So this density of census, so it means that there are high chances that this disease will get, or the this pandemic will get spread easily. But the seroprevalence study shows that our protective measures were effective. That's why more than 50% of the total population is still unaffected.
But the rest of the country is seeing a downward trend, but in Kerala, it's just the opposite. So, what really is going wrong with the much celebrated Kerala model?
ICMR seroprevalence study is actually a good data on Kerala model. It shows that the seropositivity of the state is 42.7%, which means that more than 50% of the total population is still unaffected. They are vulnerable or susceptible, which shows the success of our method or our protective mechanisms. So we can develop antibodies in our bodies either through infection or through vaccination. So this shows that the people are not, more than 50% of the people are not yet infected. That's why there is no antibody in their body, and we are and when you consider the vaccination process, we have covered more than 68% of the total population now. As per the latest data, 68% of the total population with first dose, and we have covered our entire population above 60 years of age, and also the bedridden patients, the palliative care patients. We have given first dose vaccine to them. So we are trying our best to vaccinate our people within the minimum time.
Ms. George, one reading can be that this ICMR survey, as you're talking about the ICMR Sero survey, which shows that half of Kerala's population is still vulnerable, is actually showing that Kerala seems to have dropped its guard. The government has dropped its guard. Why did the government do that?
ICMR seroprevalence study shows that more than 50% of the total population of Kerala is still unaffected, which means that we have the highest number of susceptible persons in the country. We are doing maximum tests these days. The test per million in the state is the highest in the country. Our undercounting factor is the lowest in the country. We do report every case in every 6 cases, whereas the national average is 1 in 33. So the test per million is highest in the country, and the undercounting factor of our state is the lowest in the country. And we do have the maximum number of susceptible persons or vulnerable persons.
Yes.
So there are high chances that more cases are getting reported, and we are trying to report every single case. We are tracing, testing, and we are giving them treatment. So our strategy was always to keep the number of positive cases below the medical capacity threshold.
Okay, that brings me to my last question. What is the state government doing to bring down these numbers, and is the state really prepared for the third wave?
The first case in the country was reported in Kerala back in January 2020. It has been 1 year and 8 months since the first case was reported here. Government of Kerala has the responsibility to protect the lives and the livelihoods. When you look at the fatality rates due to COVID, when you look at the fatality rates of different states, you can see that Kerala do have one of the lowest fatality rates in the country. It's around 0.5%, which again shows that the system, the method we have evolved, the detection in Kerala is successful. And in Kerala, we ask our people to have a COVID appropriate behaviors. People wear mask when they are outside their houses, and also if they are working outside, and if they have children and senior citizens in their houses, we ask the people to wear mask in the houses also, inside their houses also. Also, the government of Kerala has allowed only 20 persons in wedding ceremonies, in funerals, etc. So social gatherings are not at all allowed with the large crowds. So there should be limited number of people.
Okay.
And we are doing intense campaigns. So the fatality rate, the undercounting factor, everything, also the seroprevalence study of ICMR, everything shows that the protective measures of the state are good and they have proved good. So the government of Kerala, we are closely observing the situation. We have a monitoring committee chaired by Honorable CM, and we do the analysis. We process the data. We have in our health department, we have an excellent surveillance team at state level and also at every district. So they collect data, they
Okay.
process data, and based on the data, we do take collective decisions.
Okay. Veena George, appreciate your time. Let me bring in my guests now. Dr. Raman Ganga-Khetkar is a renowned epidemiologist. Dr. M.R. Rajagopal is former chairman Pallium India. Dr. Anish T.S. is member COVID-19 Kerala expert committee. I'm going to begin with you, Dr. Ganga-Khetkar. Is there really a strategy in place when the minister says that they have tried to ensure that the numbers are within that limit so that the state can take care of the patients? I want to understand what's really going wrong with the state.
No, it's difficult to say whether things are going wrong or what. The numbers are always expected to increase as the vaccination coverage also improves and lockdown related steps are relaxed as the time passes by. Because the vaccine does not protect against infection, but it protects you against severe COVID. Lockdown measures are relaxed. You will find that at every stage, the proportion of people who are likely to be exposed increases, and therefore they are likely to acquire infection. So new infections are increasing. To me, no new infection, more than new infection, when you look at this stage of the pandemic, where we are in a stage of risk of reduction of risk mitigation stage, there you have to look at number of hospitalizations that occur, number of deaths that occur, rather than number of new infections that are occurring as the first monitoring indicator. And if you are able to provide in this risk mitigation stage the healthcare to those who need, I think we are still on the same line. It's only a question that we perhaps need to intensify contact tracing, testing, as well as try to enforce COVID appropriate behavior with the population. Perhaps that will reduce those numbers.
And Dr. Anish, what is also being said is that there has been an unscientific relaxation, wrong containment measures, and superficial lockdown on weekend. That is going wrong with Kerala.
No, as Dr. Y is already saying, it is not the time for containment. Actually, it is the time for mitigation, because we have vaccinated somewhere around 70% of the total people or adult population in Kerala. And there is no point in containment because Kerala was successfully containing the outbreak. That is why Kerala reported the lowest seroprevalence rate all over the country. Now we have got two options in our hand. Either we prevent infections by allowing natural infections. That is actually happened for almost all other part of India. We are not getting cases from other part of India because the Delta wave was already happened all these places. And if you are allowing that kind of infection to happen, whether you account or not, it will end up in large number of casualties. But it is the problem what we are seeing in Kerala is because we are comparing with the rest of India. If you compare with the European countries where they are fighting the infection through vaccination and by these kinds of mitigation strategies, we won't find anything different in Kerala. That is what we have to think.
But Dr. Anish,
because Kerala is
when we were discussing the first and the second wave, at the peak of it, we were discussing how good Kerala's strategy has been. I remember that the 1 month period of the second wave from the third week of April to mid-May 2021 was when the number of cases peaked for every state. Kerala's daily case tally also peaked during this period, but was way higher than larger states including Uttar Pradesh, Tamil Nadu, Madhya Pradesh, Andhra Pradesh and others as well. So, you know, it is often said that Kerala was not only unable to flatten the curve, which almost all other states could accomplish, but also the case graph seems to be on a plateau since June 2021.
Yeah, definitely. Kerala, if you look at the scale, time scale, and you just look at the numbers, and we will see that Kerala was successfully putting numbers on a larger time scale. If you look at look at the numbers of real hospital data, at the peak of second wave, that is somewhere around first week of May, in Kerala, around 15,000 hospital beds were full, and now it is only less than 10,000. And in May, there were somewhere around 6,000 oxygen beds were full, but now it is less than 4,000. Definitely, if you look at the ICU, at that point of time, somewhere around more than 3,000 ICUs were full, but now it is less than 2,000.
Okay.
But we have got some margin, but it's very important that we have to contain numbers, definitely.
Absolutely.
Because of the post-Onam surge, we are going for large numbers, maybe at least 10,000 additional numbers compared to the
30,000
previous
cases in the
week.
last 24 hours. That is alarming, certainly. Dr. Rajagopal, at a time when it should act in a swift manner, what we are seeing from the government largely is a sense of gloating over the latest Sero survey report, which has stated that Kerala has had the lowest exposure. I'm trying to understand, how does this actually mean that they have done well? Would you say that there is almost like some kind of false sense of triumph here?
It's easy to be either defensive or critical. We have to look at both sides of the story. If the controls were more strict, if the lockdowns were strict and continued for a long period of time, the numbers would have been less. But look at the other side of the story. We talk about the numbers of COVID. How about the number of people suffering from the lockdown, from loss of income? Fortunately, in Kerala, those things were reasonably contained even during the lockdown by community kitchens, etc. But now we have a choice: enforce strict lockdown and allow people to starve, allow people to suffer without adequate access to healthcare for other problems. I think that balance was essential. Maybe we could have been a little more careful about the festivals. That's one thing that I would say, that we did something that could have been different. But otherwise, the vaccination drive, the balance between a lockdown and COVID control, those are, I believe, if we have to look at the whole thing again, we would have done those things. That limitation of lockdown was justifiable in terms of the suffering of people.
Okay.
People need to eat. They need to feed the children.
There is another side of the argument that is being put forth by the government of Kerala, Dr. Raman Ganga Khetkar. The Kerala government is trying to establish that the huge number is due to daily testing of nearly 2 lakh people. However, states like Telangana, Assam, with the same population of Kerala, is testing 1 lakh people per day, and and their positivity rate is around 1% and less. Kerala may be testing double, but the rate is above 18–19%.
Yeah, perhaps that logic may not be appropriate for one simple reason. It all depends on who are you testing. Does it have adequate number of those people who actually require testing, and what numbers come out finally as positive? So essentially, what does it mean? That infection is present in Kerala in larger proportion as of now. We need to accept that compared to what may be happening in whatever state you are comparing it with. For the sole reason, there perhaps one assumption we will have to make, that the testing that is done in other state is also done to diagnose COVID-19 infection on medical grounds rather than for travel purposes. We will have to weed out that proportion of testing or those numbers out of testing which are done for travel purposes.
Okay, okay. Dr. Anish, that specific point being made by Dr. Ganga Khetkar here on testing for travel purposes and what Veena George had told us, that this is about population density, which is more than twice the national average, which explains the high number of cases in Kerala. But it still doesn't explain to us as to what really is going wrong in the state, that the cases are surging at this rate. And is the state government sure that this is still second wave which is continuing, or has third wave already hit Kerala?
No, I am not fully agreeing with this comment, because suppose we are going for a lockdown. What is expected to happen in the lockdown? Your zero prevalence should be very less, because you are in a lockdown and the infection should not happen. That means if you look at Kerala, and you can see that at the time of lockdown, the infections were much less. After lockdown, if the locks are released, what should happen? People are going to mingle each other and the infections should rise. But after lockdown, if there is no infection, you have to just look back and you should see that whether your lockdown was effective or not. In COVID-19, what is the universal strategy is actually flattening of the curve. It doesn't mean that the cases are not happening. It means the cases are happening, but we are flattening it for a longer period of time, so that we have got enough system in our hand, health system in our hand, to take care of the infection. So at that point of time, definitely Kerala is doing a good job. But the problem is, because of the festival and all, now we are facing large number of cases and we have to be very vigilant. And the testing strategy, as respected minister has already said, we have got a very good surveillance system and targeted testing that is happening here. And we have got a lot of risk factors other than the population density. If you look at the number or the proportion of vulnerable population, more than 65 age group. Okay. In India, it is somewhere around less than 10%, but in Kerala, in our population, more than 50% of our people is actually elderly. Okay. That is more than 65%. Okay.
We have
so
exactly
we have got a lot of vulnerabilities
40
as a
seconds
state, and we are
for
trying
Dr. Rajagopal.
Prevent infections, and we are
Dr. Rajagopal, what should Kerala do?
I think as we already mentioned, Kerala is possibly a victim of its own success. We plateaued the curve adequately and therefore prevented the mass casualties from the disease. And therefore, the infection rate is still high. And maybe though our vaccination has been very good compared to the rest of the country, not globally, maybe if during that plateauing, we could compare with the Western countries, which is not reasonable to expect, then maybe this would have been better. The two things that we could do more. We have done that. The suffering. I wish somebody had a measure of the suffering due to COVID. And if you compare that with the rest of the country, Kerala, in spite of the numbers, is doing far better, far better.
All right, Dr. Rajagopal.
And this is not a small thing.
We have really come to the end of this discussion. My producer is instructing me to end the show. Thank you so much for joining us, Dr. Rajagopal, Dr. Ganga Khetkar, and Dr. Anish. Of course, this discussion will be continuing, because only in the last 24 hours, we have seen Kerala report over 30,000 cases. That's all from me. Thanks so much for watching.